Well, good morning. I'm MMAC President Tim Sheehy. I want to thank you for joining our weekly webcast on business and community strategies, which run every Tuesday from 11 to 12. MMAC's mission is to develop this region as a globally competitive location for businesses that deliver high-value jobs to support a vibrant quality of life for all. This program is designed to provide actionable insights to the challenges and opportunities we all face in bettering this region as a place to live, work, play, and learn. The webcast is powered by Aurora WDC, a Madison-based market and intelligence firm to help us make faster and smarter decisions. Visit them at aurorawdc.com. We're going to start with a COVID-19 update from Dr. John Raymond, president of the Medical College of Wisconsin. And then we have a great panel to discuss COVID's impact on K-12 education, how schools open, educate, and resource the needs of students and families. We're going to be joined by Dr. Patricia Hoben, Executive Director of City Forward Collective, which is a collaboration focused on eliminating educational inequities and ensuring every child has access to a great school. We're also joined by Gutierrez, Executive Director of the United Community Center, Rauh, CEO of Milwaukee College Prep, and Anthony McHenry, CEO of the Milwaukee Academy of Science. If you've got questions during the program, please submit them and we'll do our best to answer as many as we can. So let's start with an update on COVID-19 with Dr. Raymond.
Thanks, Tim, and good morning, everyone. I'll start with the testing data. We've administered over 870,000 COVID-19 tests in Wisconsin and over 180,000 in Milwaukee. And those are actually individuals. Some of them may have been tested more than once, but they're only counted once. So we've had almost 50,000 positive tests since the beginning of the pandemic here. And that's a 5.7% average positivity rate since the beginning of the pandemic. And unfortunately, that's been increasing over the last few weeks. Ideally, we want to see that positivity rate well below 5% for a sustained period of time. That means we have enough testing capacity and that we're administering the tests where they're needed the most. In Milwaukee, we have over 18,000 positive tests with about a 10.1% positivity rate. And that also is increasing. Now, yesterday was a light reporting day, and we only had about 7,000 tests reported, and we've been running anywhere between 13 and 14,000 on average for the last couple of weeks. Now, our testing capacity is stable at 24,156 in Wisconsin, but I do need to send a cautionary note. What I'm hearing from the testing laboratories and from our health systems really is a uniform expression of new concern about the supply chain of nasal testing swabs and of reagents for the PCR test. And that's in part being driven by the surges that we're seeing across the Sun Belt. So our supply chain remains fragile and continues to be vulnerable for these testing reagents. Now, we're stable at 83 laboratories that are currently testing and 24 still planning to test. Now, in terms of positive tests, we've been at or over 900 8 times in the last 2 weeks. And that's a concerning trend that we've been talking about in the last few webinars. Yesterday, again, was a light reporting day, but we still had 590 positive test reports with 162 in Milwaukee. That's an 8.5% positivity rate in Wisconsin and an 11.7% 7-day average positivity rate in Milwaukee. And you'll recall that the number of positive tests and the positivity rate are very early indicators. So if we go to the next slide, please. I normally tell you about the number of cumulative hospitalizations, and we have about 4,420 since the beginning of the pandemic. And again, the likelihood of being hospitalized with COVID-19 continues to go down, which is good news. So our average rate is 8.9%. So if you have a positive test, you've been 8.9% likely to be hospitalized. Now, the reason why that admission rate is going down, there are 2 of them. One is, even though I mentioned some concerns about testing, we have a lot more tests available now than we did even a month ago. And I think that's helping us. We also know better how to treat, support, and triage people with COVID-19 and can do a better job of taking care of them out of the hospital than we could even a couple of months ago. So I did want to report on hospitalizations, but unfortunately we have no complete real-time hospitalization data for the last week because of a switch in reporting requirements from the CDC to HHS, and that's a federal requirement. I think the dashboard is going to be enhanced, so we'll have enhanced data sets, but those won't be available on the Wisconsin Hospital Association website until later this week. So the best I can do is tell you what the trends were before the middle of last week. So before the data blackout, hospitalizations and ICU use had been trending upward for several weeks, which was an unfavorable trend, but we were still well within the non-surge capacity of our health systems to take care of both COVID-19 and non-COVID-19 patients. So these critical data are not available today. I don't believe that there have been significant changes in hospital capacity over the last week based on a few phone calls that I made. But please stay tuned because those data are going to be very, very important because these are lagging indicators. They'll lag by 2 to 4 weeks after you start to see an increase in the number of tests. And one thing I do want to point out that personal protective equipment trends still are stable. Our most critical needs are goggles and gowns, as you can see at the bottom of the slide. But I've also been hearing from our health system CEOs that they're expressing new concerns about the fragility and the vulnerability of the PPE supply chains. Again, for the same reasons that they express concerns about the availability of reagents for testing. Many of those have been redeployed to the Sun Belt. So these will remain a concern for us going forward. Next slide. I want to talk about deaths. Now, death is the most important, but it's also the most significant lagging indicator. Now, deaths are going down in terms of the infection fatality rate in Wisconsin, again, in part because we know better how to take care of COVID-19, and in part because we're testing and detecting more cases of COVID-19 when they're pre-symptomatic or asymptomatic. So since the beginning of the pandemic, the likelihood of dying if you're diagnosed with COVID-19 in Wisconsin has continuously gone down, and now it's at 1.8% cumulatively. Also, we have 893 deaths. That's less than many of the states surrounding us, and we did have a very significant, clear decline in the death rate, both in Wisconsin and in Milwaukee, but that decline is flattened out and may actually be going up. There's a lot of variability in the data, so this is something that bears watching because, again, this is the most important indicator, but it could lag the increase in the number of cases by 5 to 6 weeks. And as you can see, we still have a significant number of the deaths here in Milwaukee with 379. Now, deaths, like the number of newly diagnosed cases and the positivity rates, disproportionately affect people and communities of color, as you can see on the table on this slide. Now, just in terms of trends, what we're seeing is that the number of new cases in Latino and Hispanic communities continues to rise. The number of hospitalizations and the number of deaths are also starting to rise now. So again, those are lagging indicators. So we need to focus our efforts on the near south side of Milwaukee and redouble those efforts because that is a population that's at risk. Now, the reproductive numbers remain above 1 at 1.06 in Wisconsin and 1.02 in Milwaukee. This is an early indicator that measures the contagiousness of the disease at a given place and at a given time. And what you want to see is a reproductive number of less than 1. What that would mean is that a person who's infected with COVID-19 on average would transmit the disease to fewer than 1 people during the course of their disease. Now, we've had 39 consecutive days over 1, which is a troubling and unfavorable trend. And we want to see that be substantially below 1.0 so that we know that we're decelerating the pandemic. Next slide, please. Now, for the next 3 slides, I'd like to set up the rest of our webinar today by talking about some considerations for opening schools. So I'll just start with some data. We know now that children are less likely to require hospitalizations or to become severely ill with COVID-19 That doesn't mean that they couldn't be hospitalized, couldn't become ill, or couldn't die, because clearly children do, but much less likely than adults. And we also know that many children are asymptomatic. And in the USA, only between 2 and 3% of patients that test positive are children. Their hospitalization rate is less than 1%. And the mortality rate is significantly less than 0.1%. And in fact, if you look at those two, the hospitalization rate and the mortality rate, that's on par or maybe even a little bit less than seasonal influenza, which disproportionately can affect children. Now, we do know that children can suffer from a unique inflammatory disease called multisystem inflammatory syndrome in children, or MISC. This is very rare, but it is life-threatening complication of COVID-19 in kids. What we also know now, based on recent reports, that children, in fact, do transmit COVID-19, both among children and to adults. And children have viral loads, or an amount of virus in their nose, on par with adults. We also know that children under 10 years old are only half as likely as adults to spread COVID-19. So if you may have heard that children don't pass along COVID-19, it's simply not true. They definitely do. They can spread it among kids and adults, but they're only half as likely as adults to spread COVID-19 if they're under 10. Now, interestingly, children ages 10 to 19 are actually as likely or more likely than adults to transmit COVID-19. And I will call your attention to the study listed at the bottom of the slide if you're more interested in those details. Next slide, please. Now, just in terms of considerations for opening schools, we know that multi-generational homes or domiciles may be at a higher risk for in-home transmission from children because you can't segregate grandparents and parents from their kids. But we also know that school is critical for socialization. We don't want our kids to miss a year or 2 years of the opportunity to learn how to interact with other kids and adults. We also know that some families and neighborhoods still do not have internet access, and some families don't have computers, which are limiting factors in delivering distance education. We also know that essential workers might not be able to find childcare or to homeschool their kids, and this is a limiting factor in terms of delivering in-home schooling. And we also know that compliance with social distancing, face covering, and hand washing is likely to be problematical for kids, especially those under the age of 10. Next slide, please. On this last slide, I just want to talk about some considerations for assessing the physical plant to see whether it can accommodate appropriate mitigation strategies for COVID-19 in schools. You know, we'd like to isolate teachers and students into bubbles or pods, and that's a concept I think everybody's aware of if they follow the NBA, so that you're not having a lot of interaction with people that wouldn't be necessary. You'd like to have staggered start and end times for classes so that you don't have highly congested hallways where children are moving from classroom to classroom. And you do want to optimize the walking traffic circulation in your facilities. You also want to try to separate children for playtime, physical education, music, and band. And those may be very difficult for certain schools to accommodate. Appropriate frequent hand washing, and the physical plant aspects that people may not think about, but are important if you think about the potential for aerosol spread of COVID-19, would be that your HVAC can accommodate frequent air exchanges, preferably with air that's circulated from the bottom up, filtration, and again, upward evacuation of air. Drop off and pick up traffic patterns for children, also very, very important. You may want to have staggered drop off and pick up times. Isolation in the facility of symptomatic children that can't be returned to home immediately. Well, how do you handle meals and snacks so that people aren't touching each other? Safe sanitization practices, physical distancing, masking, face shields, and plexiglass dividers when appropriate. So these are all really important considerations, and I'm so pleased that we have 4 experts that have thought deeply about them. And with that, I'll turn this back over to Tim.
Dr. Raymond, again, thank you for the very thorough update. I know you're going to stick around for questions. And as you've kind of finished the presentation and we've gotten into some of the school issues, let me bring our school panel on here. And again, let me start by introducing again Dr. Patricia Hoben, who heads the City Forward Collective, Rauh, who runs Milwaukee College Prep, Anthony McHenry, who runs Milwaukee Collegiate Academy, and Laura Gutierrez, who runs the United Community Center. And so the Milwaukee Academy of Science, sorry, Anthony. Patricia, let me start with you. And if you could just describe a little bit who City Forward Collective is and what it does.
Sure. City Forward Collective is a citywide education support organization. Our mission is to ensure more high quality seats available for any child in the city who wants one, and to eliminate the educational inequities that have gotten in the way of assuring that every child has the resources they need to be successful in school, which would lead to graduating from high school ultimately with a choice in life, a choice to be working, or a choice to go to post-secondary education. And we do that work with, we have 3 buckets of work, as it were. One is talent. It's impossible to have high quality schools without a strong talent pipeline for leadership. And also improving the numbers of Black and brown teachers in our schools that serve predominantly Black and brown children, and from households that are low-income households. And then policy and advocacy work to ensure at the state and local level we have policies and practices that ensure the rapid growth of high-quality schools where they exist. And then the third area of our work is strategic investments. So we're an organization that both runs programs but also gives grants to organizations to support schools and to schools themselves to grow and expand, and also to help promising schools move to high-quality schools.
Okay, can you also kind of give us just an overview as we start the education landscape in the city of Milwaukee, kind of where kids go to school and what the distinctions are and the different ways in which we deliver K-12 education?
Sure, and I think it would be fair to say that for a city the size of Milwaukee, we probably have one of the most complicated education ecosystems in the country. We have 3 education sectors. We have Milwaukee Public Schools, which is a traditional public school district. We have public charter schools, and we have Milwaukee Parental Choice Program schools, which are private schools, often religious schools that receive public dollars through vouchers. And so right now there are 66,000 students in 137 Milwaukee public schools that are managed and staffed by MPS. And then there are 146 charter and choice schools serving about 45,000 students. There are about 27,000 in private schools and about 16,000 in public charter schools.
And then just kind of one other basic setup as we get to Rob and Laura and Anthony. What is a charter school? Who are the authorizers? And really, what is the difference?
Yeah, so there's 3 authorizers in the city and a state authorizer for charter schools. So there's Milwaukee Public Schools authorizes 2 kinds of charters. One is called an instrumentality charter school, which strictly means that the staff in that building work for the district and are part of the district personnel. The non-instrumentality charters are independent charters that are authorized by Milwaukee Public Schools but governed by an independent board, and the staff is not part of Milwaukee Public Schools. And then UWM and City of Milwaukee are both active authorizers of public charter schools. And recently the state became an authorizer that technically Milwaukee schools are eligible for, but no Milwaukee schools are currently chartered by the state at this time.
Great. Rob, let me start with you and just have you describe Milwaukee College Prep, its approach, and the students that you serve.
Great, thanks, Tim. So Milwaukee College Prep is going into its 24th year. We service students basically along the North Avenue corridor between 12th and 38th Street, 4 campuses. And we are a non-instrumentality charter with MPS. And so our basic philosophy is a belief in rigor and relationships, and believing in the potential of each student, and with great teaching and positive relationships, we can overcome some of those opportunity gaps that Patricia referred to. And right now, our historical graduation rate has been over 95%, which is about 30% higher than their peers would be in the city.
Great. Laura, let's talk a little bit about UCC and then Bruce Guadalupe and how you're engaged in the education arena.
Hi, thanks, Tim. Thanks for having us on. Yes, UCC has been a pillar here on the south side of Milwaukee for 50 years and have been involved in education for, I would say, the last 20 years here where we took over Bruce Guadalupe Community School. So we educate about 1,700 students at Bruce Guadalupe and Acosta Middle School, which focuses on STEM. We're an independent charter school in which 75% of our families qualify for free and reduced lunch. 97% of our families are Hispanic. We have an English language learner population at Bruce Guadalupe School, which is our K-8 pipeline. That's at a 22% with a 12% special education rate. And at our Acosta Middle School that focuses 6th through 8th grade, we have a 20% of our students are special education and 27% are English language learners. So for us, as Rob and Patricia mentioned, it is critical that we educate our children who the majority might be first generation students that are in this country without really knowing how to navigate it. And then we also support our students as they graduate from 8th grade and they go off to the best performing high schools within the city with our pre-college program. So really walking them through what does that look like, financial aid, course selections, so that they have the best fighting chance of having a choice of what they want to do from an educational standpoint or workforce.
Thank you. And Anthony, talk a little bit about the Milwaukee Academy of Science and the students you serve and the focus of the school.
Happy to do so. Milwaukee Academy of Science is a K-4 through 12th grade public charter school authorized by the city of Milwaukee, serving over 1,200 kids. Our population is 94.5% economically disadvantaged. We're 99% African American. And our approach to education is we want to provide a quality STEM focused education through an equity lens. A part of that is we provide school bus transportation for over 800 kids coming from 21 different zip codes. Despite what may seem to be challenges, we're pleased to say that we now have 5 consecutive years of all of our seniors being accepted into post-secondary education, including 5 who received full scholarships this year.
Thanks very much, all of you, for that introduction. And I'm going to say up front how lucky we are to have each of you in the roles that you're in, serving students in the city of Milwaukee. So Patricia, before I ask Rob, Laura, and Anthony about their own plans, can you give us an overview? I mean, the big question, you know, parents are asking and employers are asking because parents are workers too. What are the plans going forward for opening schools in the city? Where are we today, and what does it look like?
Yeah, let me just, you know, back up to the spring. I think what we had is a wide array of reactions to a sudden closure of schools for the first time in generations. And quickly it became clear that this ecosystem that we have, which is so diverse in terms of school sectors, there wasn't a single decision maker that was telling us as a city, this is what schools need to do. These will be your next steps. This is what we want to see with remote instruction, and let alone, this is going to go on through next year. And so you better reserve some time over the summer to be planning for it. So I think all the schools and all the sectors throughout the spring learned a lot. Some were able to be very nimble and quick in response. others, larger. I think, it was hard to be as quick and nimble in response, but everybody learned something about what they did well and what their challenges were. And all schools throughout the city have been spending the summer planning for reopening. And there's really two parts to the reopening planning that schools are working on. One is just that education program delivery. Everybody is trying to make a plan for what fully remote education would look like, fully in person, and then hybrid, part in person and part remote. That's quite complex to be asking schools to be able to do that. On top of that, they're also having to develop public health and safety plans for how do they operate their buildings. And one of the things that I think probably in other webinars MMAC has had, or throughout the last 10 and 20 years, I think we're all aware that the school building infrastructure in our city is in great need of repair. Most of the school buildings don't have listening to Dr. Raymond talk about ventilation, which is one of the things people are trying to figure out. Most schools' ventilation is an open window and fans. September is one of the worst times to be in a school building in most buildings in our city because there is no ventilation. And so, these are areas of expertise that our school leaders are not trained in. And so what City Forward Collective did is we created a planning template around those two large components. And we gave some planning grants across schools in the city, but also offered 9 two-hour workshops that we've been in the middle of this summer, and the leaders that are here with you today are participating in, so that we can together share ideas and best practices, dig into CDC documents and other national documents with some national facilitators, and figure out the most robust school reopening plans. That said, and a lot of people think schools are off in the summer, and leaders have this great opportunity to have a month off. I can assure you, nobody's taking any time off. It's a 12-month job here, and they're trying to figure out how to reopen. And what's become clear is that first MPS said we're not going to be able to do this, and many of the schools, most of the schools, are now saying we're going to have to start remote. And it's partly because there's so much uncertainty in the public health of what's going on around us, and so many of these schools are in neighborhoods with 35% positivity rates. It's really hard to imagine opening a school under those conditions, if you can or not. But I think largely is we're just not ready. We're at a point now where the health department, we're working with the health department to create a tool that schools can assess, that can be used to assess school plans. That tool isn't done yet. We have a great team at the health department, but it's going to be a big challenge having to review the plans for over 200 schools, even if some of them are reviewed under an umbrella of single operating unit. So I'm encouraged by what I've seen from the health department. I'm super encouraged by what I've seen from the leadership teams, but I wouldn't expect very many schools to be opening, say, beyond maybe 25%. And I think what we're all hoping is that who we will prioritize is those kids who were most impacted negatively in the spring because of their home situation, and they need to be in a building, they need to be served, there's nowhere for them to go, they won't be learning at home. And so I think that's what I've heard the most. That's where school leaders want to start, but we have the experts here. So.
Sure. So Anthony, Laura, and Robert, let me ask you just as we go around here. So Anthony, what are your plans for the school, and how are you assessing opening?
Sure. Well, let me start by saying we spent the majority of the late spring and summer planning for, as Dr. Hoben said, 3 different types of opening. Full opening, which we didn't spend much time on, a hybrid opening, and a full virtual. And up until just over a week ago, we thought that there was a pretty good chance that we'd be able to open with a social distancing school, knowing that about 33% of our families had already indicated that they were not going to be sending their kids to in person, so they could opt out, and we would have a virtual program. And we're happy to do so. And then when MPS indicated that they were going to start virtual, I think the following day the health department indicated that unless the city was at a phase 5, no school would be able to open. We quickly pivoted once again to focus in on a virtual program to start the year. In doing so, we moved the start of the year back from August 17th to August 31st to give us more time to provide the professional development that our staff needs to make sure we're providing the highest quality education possible. So at this point, we are going to start virtually. We'll continue to work with City Forward Collective to develop our school opening plans, but we're not necessarily in a hurry to open until we believe that the city is prepared to do so.
Yeah, Laura?
Yes, thanks. We have decided, again, just as Anthony mentioned, we have all 3 scenarios planned, and at this time we are hoping to open in a hybrid model. We have surveyed our parents on very different occasions. Currently, we have surveyed them again to choose an in-person option or a virtual option, and we have 51% of our parents so far that are saying they need in-person for all of the reasons that were mentioned before, with the family dynamic challenges. They're essential workers. They may not have access to internet. And just from looking, Tim, at the decline that we saw over our summer school, it was very worrisome for us. Usually UCC has an attendance rate of 83 to 85% in summer school. We just finished that, and we saw a variance from 40% engagement to 63. To us, that is letting us know that we have a lot of parents who do not have the availability to be able, or flexibility to be able to stay home and become their child's teacher. And we all know that, with education being the great equalizer that it is, that we need to have these children in school learning as much as possible. Since our parents are being brought into the conversation, we want to be able to meet our parents where they are. We've had great success with our childcare being open for 8 weeks on 2 separate locations, and our families are, they see this as just a gift from the United Community Center that we're able to assist them in a great time of need, because what they're saying to us, it's, if we don't have a place for our children to learn and be, you're asking me to choose between my job and my child's education, and we don't want to do that. So we start training our teachers mid-August. We're hoping to be up and running August 27th, and are really hoping that, working with City Collective, that we're going to be able to get that plan approved quickly, so that we can definitely ensure our parents that we're open. And from our end, we're going to try to do everything we can to ensure that the parents have that choice.
Yeah, Rob, this has to be the most challenging of your 24 years doing this. Talk a little bit about how MCP is going to approach this.
Yeah, so I think that, our plans are similar. We have made the decision, we are definitely going to open up virtual, and we made that decision about the same time MPS did. So before the city news came out, and it's just, we've had in the past couple months 7 staff members test positive, a couple of them hospitalized, 2 students test positive. So it's the rate especially on the north side of the neighborhoods we serve, it's just too high. We can create as safe a bubble as we want for our students, but it's, there's all this engagement that happens outside the school hours, and it really, it's keeping students safe, but it's also really keeping our teachers safe. It's having all of our teachers in a building right now with the COVID rate so high would be problematic. I know university schools even requesting that all of their teachers update their wills before the start of the school year. And a law firm in town is offering free wills to any educator in Milwaukee this summer. So this is, those are maybe a little bit overreaction, but the reality is it's real, and it's definitely real in the neighborhoods that we serve. So we'll start virtual, and then hopefully be able to transition back into hybrid shortly thereafter, and start with our youngest scholars and rephase opening with our 4- and 5-year-olds first, and then first and second grade. But we're also looking to partner with the Y, because I think the most important thing from the feedback we've gotten from our parents and families and even teachers is in a situation like this, you have to offer options. There is no right answer for everyone. And so even if we are able to reopen, we will always have a digital academy for parents that want that option. And for parents who are essential workers or don't have daycare at home, we are offering a partnership with the YMCA to provide daycare for our students at a few of our campuses, and they've been doing this since March. And like UCC has done a good job with the protocol to keep it as positive as possible. It's 8 students in a cohort, and so they can spread the kids out dramatically. And so that we will offer that service to parents who need it.
So Patricia, we finished the school year last year with kind of this rush to virtual learning, and some schools had it in place and others didn't. So as we think about now going into a school year, which is really going to be dependent on virtual or distance learning, can you talk a little bit about some of the challenges across the city in delivering virtual learning? And then I'll ask the school leaders kind of, what they're doing and thoughts in their schools.
Well, the way we're looking at it is we raised a fund and to help support schools through the COVID crisis. And the first part, 1/3 of that fund has been spent in helping them with some reopening costs and undertaking this planning this summer. The second third that we wanted to invest in was taking models of success in remote learning last spring and scaling them across the city. One of the ones we piloted an investment in is a national summer school initiative that was developed by a team, including a former superintendent from Newark and a couple large charter management organizations. And I know some of Rob's students and Anthony's students participated this summer. The reason we invested in that is because we knew they were looking at taking that to a full year program. To ask school leaders and teachers to develop something for in-person and then to translate that to remote, what you normally do in person doesn't always scale and translate. And there's a lot of training that has to be undertaken for supporting teachers in remote. So one of the things we're trying to do is invest in bringing some of these national models here that to scale. The one I referenced is an elementary school model. There are some things out there in high school because we need to be able to, we can't ask teachers to reinvent the wheels at the last minute here. That will really hurt children. So we need to take the best of what's out there and invest in that. So that's how we're trying to support schools right now. The other big area is internet access that was raised before. MPS has an initiative now where they're raising funds to support about 20% of their students that don't have internet. And so I've been working with the charter and choice schools because they're not part of that initiative. And, can we get a similar very low cost deal where we get internet access through mobile hotspots to students? So that's something that we're going to be asking the business community to help on and as we move forward. Good.
I'm going to go to the audience here and ask, we'll share some of the questions they have. Before I do that, though, again, Rob, Laura, and Anthony, this is shaping up to be a really challenging school year, which is probably the understatement of this webinar. And there's really a threat to a growing divide in educational equity. What do you think are the biggest challenges, and how can the business community and community help you serve your students? I'll start with you, Rob.
Yeah, well, when you address the equity divide, it's like being analogous to saying if there's a strong tremor in Arizona, will the Grand Canyon get a yard wider? I mean, the equity divide in our city has been prevalent for so long, and this certainly will exacerbate it. But it's an issue that has not been, rectified or remedied despite lots of different efforts. So it's an opportunity gap. It's not an achievement gap. And when you look at the different opportunities, and when you are in a crisis like this, income just exasperates the opportunities students have. And so lots of families are hustling to form educational pods or hiring tutors or, upgrading wireless service. And for a lot of students, and Howard Fuller talked about a third of his students were essential workers once the pandemic hit, and it was impossible for them to do online learning when they're out working 8 to 10 hours a day and supporting their families. And for a lot of our families, they're daycare providers, they're, and there's a lot of other things that the opportunities aren't there for them to be able to sit down in front of a computer and really focus on what needs to happen. So this will certainly create that divide. It will be larger, and it's just up to us to do the best that we can to service our students. And it's kind of like virtual learning is a little bit like a long distance relationship. You can have a lot of great conversations, but it's just not quite the same as being in person. And so hopefully we can get back there sooner than later.
Good. Laura?
Yeah, I would agree with what Rob stated. I think that is one of the things that keeps us up at night, with just trying to balance not only all of the information, but the mandates that are coming from the city or at the state level, and then trying to put that all together to also balance the safety, safety and needs of our parents and staff. I think really have kept us all up at night. But I think the biggest issue is that equity. And how do we continue to provide inner city children with the best possible education and allow their parents to continue to keep their jobs so they can financially continue to keep food on the table and move on in that financial trajectory. When we look at the stats here in Milwaukee, you have 10% of Milwaukee high school graduates that are African American and 13% of Latinos. That, when I think about the opportunity I had of education and how suburban children are now encountering back to school, contact sports, they're going full force and have made that decision. And these are the children in Milwaukee that have to compete with that. I think we really have to factor that. I can tell you I felt much better after seeing Dr. Raymond's slide. The last slide, which allows us, UCC has done a lot of that, just like I know a lot of the schools have invested so much money to keep our staff safe and students as much as possible. But I think we have to start and focus on what is it that we can do and provide. And if half our families are choosing this is what we need in order to continue to accelerate our family from an education trajectory, and starting out slow and mitigating and navigating through the issues at that point, it might get a little bit easier to really give the students the necessary tools in the event, because it's not, is it going to happen? It's when is it going to happen that we might have to go all back virtual. And I think having students and staff in front of the children, even if it's for 2 weeks, that opportunity there to be able to skill them up on their computers, because we've purchased computers for all kiddos from kindergarten through 8th grade. Now, when you get into the 4-year-olds, you also have to balance screen time, engagement, with also fatigue, and being intentional about the education that's being provided. So it's a lot to balance, and I think we just have to take it day by day and make the best choices and decisions for our families that we're serving at that moment.
Anthony?
Yeah, I think Rob and Laura hit it on the head. There's no way around it that the disparities are going to continue to persist through this, and maybe even be even worse after the conclusion of this. When you think about the fact that I had a board member tell me that the day that they closed, every kid at their school, a suburban school, walked out with their own personalized laptop. And while we're pleased at Milwaukee Academy of Science that the day after we closed, we had a full virtual program, what we all know is that the majority of the kids in the city, 6 or 7 weeks with limited contact with their schools. And so those are the type of realities that we're faced with that here in the city. And even within, low income neighborhoods, you take a school like Milwaukee Academy of Science, serving kids, a little more than a third of our kids come from 3 of the most impoverished zip codes. On a given day, we have between 60 and 120 kids that are classified as homeless. trying to provide a virtual program for those kids is I wouldn't say impossible, but extremely difficult. We were in conversations this morning about mobile hotspots, though. So as families are going from house to house, they might be able to take their hotspot devices with them. So those are the type of challenges that our families are facing. The social economic status is going to continue to make the divide even greater. We're trying to provide the most rigorous instruction possible. I think that even at our lowest grades, we're looking at over 3 hours of synchronous instruction, but we know that the family dynamics may not always allow for that to happen. And so we are just hopeful that things can turn around and we can get our babies back in the building as quickly as possible.
Great. So let's bring Dr. Raymond back in, and Chris, if you've got some questions from the audience.
Sure, thanks everybody. And we had a lot of questions about metrics. First of all, for schools that are starting in person, how would you decide that you have to shut it down and go virtual? And for schools that are starting virtual, how can you decide to maybe ramp it up and go back to in person? I know it's a difficult question, but if anybody has a perspective on that, we'd love to hear it.
Patricia, do you want to answer that? I think we're waiting on the health department to kind of help us with those metrics.
Yeah, I wanted to hear what Dr. Raymond said because I thought he might have the magic answer, but the reality is that's what we are waiting for from the health department, is that very thing. What is going to be the school response, for when we get X number of positives between students and staff in the building? And also if there is somebody at home that tests positive and the student's been exposed and been in the building, how do we handle that? That protocol hasn't been laid out yet by the State Department of Human Health Services. And if they don't, our understanding from the health department is that they will put one forward for Milwaukee as a starting point for us. But Dr. Raymond may know more about that.
Yeah, Patricia, I think you're right. We really do need to be consulting with our local health departments to get the best guidance. But I would think that if you had an in-school transmission that was documented that went out of one bubble and into another, that would be a trigger that would make me consider going to virtual. Or if you have a soaring number of cases in the neighborhoods that you're serving, where you think that the risk of bringing people together, even if they're kept in a bubble or a pod, would be high. Those would be two general categories that I would think would trigger a rethinking or a hybrid model, or even sending kids back home.
You know, that issue that you bring up, if I can just say, Dr. Raymond, because in other states they've set a threshold that if it gets above 5% for X number of days, then schools will shut down. But my understanding is that's not necessarily the direction the health department is going to go. And I think schools have a lot of questions, because even if we're down to 8.9% positivity rate or whatever our citywide average is, the leaders that you have in front of you today are in neighborhoods that are between 20 and 38% last I looked. So, you know, does that matter, and does that need to enter into schools' decision making? I think it's something that hasn't been resolved yet with our city's health department. So.
We had another question, and it might be best for Dr. Raymond. What are other countries doing to be able to return to school safely? And I suppose part of the answer would be looking at the broader environment in some of those countries and what they've done to flatten their curve.
Yeah, thanks. I think the most important consideration in these other countries is that their burden of disease and the trajectory of the pandemic are more favorable than we have right now. And in particular, I'm talking about China, the Pacific Rim countries, and Europe. So if you have fewer cases in the community, it's a lot easier to open your schools. It also doesn't overwhelm your testing and contact tracing capacity, which is becoming a limiting factor in the US, especially in the Sunbelt states as they experience their surge. So those would be some considerations. And I really think that the macro environment is just as important as the micro environment of the individual school in making those decisions.
Thank you. We also had a question about the ability to consistently test teachers, staff, and students. Given Dr. Raymond's noting that we do have some concerns about the supply chain, is that going to be a challenge this fall?
Yes, I think it's going to be a challenge. Remember that the CDC keeps changing the guidance about who we can test based on the number of tests that are available. if that supply chain, which is very fragile and vulnerable, becomes disrupted, we're going to go back to where we were before, which is testing frontline healthcare providers, testing people that are symptomatic, and testing people that, for whatever reason, have an elective admission scheduled to the hospital. Those will be the priority areas, and any other testing capacity we have available, it's going to be difficult to extend that out to teachers, students, and employees of essential workplaces.
Question for the whole panel. We had somebody concerned about the health of teachers. What are you hearing from your teachers right now, and what can you do to kind of help them stay healthy if you're doing it in an in-person environment?
Sure. What we have done is our principals are having weekly meetings with our teachers. We have provided a $75 stipend so that they can go out and purchase any materials they would feel extra. We have inquired about HVAC. We are sanitizing every day, increased our maintenance to continue to do that, and have purchased plexiglass to keep everybody kind of shielded, masks, face shields, kind of trying to do all of the above, all of those criteria that Dr. Raymond shared is something that I feel very good that we've kind of checked the box off to try to keep them as safe as possible and giving them that confidence. I think with so much information that's out there, it sometimes can be overwhelming to figure out, can we do this safely? When we surveyed our teachers, 75% of them suggested that they were ready to come back in person because they too were worried about isolation, the regression of their students' learning. And I think it's their own mental health as well of not having students and assisting in making sure that the students have the resources they need.
Yeah, at MAS.
Go ahead.
Yeah, I was going to say at MAS, we've done some of those same things. Although we're starting virtually, we've already bought N95 masks. We bought the shields. And we have a number of different other protective measures that we have in place. But Laura said 75% of her staff said that they are comfortable coming back. There's a flip side to that. That 25% are not. And for Milwaukee Academy of Science, 31% of our teachers said they are not comfortable, even with all the social distancing measures that we plan to have in place. And so there's two things that I think we all have to focus on. Is one is how to keep the staff safe. The other is the perception that we have to deal with, that we may have a safe environment, but the first time that a kid and someone in their family tests positive, or word has it that they test positive, it can have a ripple effect in some of those. In Laura's case, 75% all of a sudden may no longer be a part of that group. And so it's something that is going to be a huge challenge for us to overcome when we do return back to school, that any bit of negative news could have a trickle-down effect to many of our staff not wanting to return to in-person.
Have any of the school leaders received, read about extra funding coming from the federal government and the state? Have any of you received extra funding to deal with the issues that are in front of you, whether it's, personal protective equipment, hotspots, any of the other things that you're doing? Can you talk about that? Rob, Laura?
Yeah, all that money as a MPS charter school goes through the district, and it's tied up in lawsuits right now. So it has not been released at this point. And the PPE equipment that the governor said he sent out, that we have not seen any of that. That has not arrived at any of the schools.
Actually, 90% of the CARES Act money that's coming to the city is routed through Milwaukee Public Schools. So they oversee all of the allocation to the private schools that are in the Milwaukee Parental Choice Program, and all of the non-instrumentalities. Schools like Anthony's and Laura's that are independent charters, they get direct from the state because they are a local education agency. So that is a concern, because I think that what we all hope is, just like Department of Public Instruction ensured that the money that they allocated to districts they took the least possible overhead they could. You know, I think 0.02% when they were allowed to take 10% off the top to manage the distribution of those funds, but instead they did not. And I think our hope for the city is that's how Milwaukee Public Schools will allocate those funds as well, is that the maximum number of dollars will go on a per student basis to all the schools that are allocated for it, because this level of uncertainty is really posing a challenge for schools. Imagine, you know, Anthony just talked about all the costs that he just submitted, but all those other schools are needing to make investments with no certainty that of how much CARES Act money they're going to see. And also the legislature hasn't closed the lid on the FY21 budget. So, you know, in a lot of states, budgets have been cut. We're in a biennium. So, you know, there was actually going to be a, you know, almost $200 increase across the city. You know, hopefully that will happen. But again, people are trying to plan, you know, without that kind of certainty. So you can imagine the anxiety that causes from the financial point of view.
Let me just wrap up with one final question here. And before, I just want to make a program note. We've talked a lot about MPS, and people may be asking, why didn't we have somebody from MPS on? We reached out to MPS and asked for them to provide somebody. They declined. So that's why we don't have somebody on here from MPS. Let me just go around the horn quickly. This is a lot of really tough news for people to absorb, and ask you, as you look forward to the school year, a positive that you look forward to as schools start to open, either in person or virtually.
Sure, I can start. I think, you know, one of the advantages is that everyone in the world is going through this right now. And so locally, nationally, we've had amazing collaboration with other school leaders and other charter organizations to share best practices, you know, to borrow and to, like Patricia talked about, you know, to not have to replicate everything. And so this isn't just a local issue, this is a global issue. And so that has been really positive to be able to network both with leaders like Anthony and Laura and other people in Milwaukee, but also nationally as well.
Great. Laura?
Yeah, I would agree. I would say that, you know, now more than ever, I think we have to continue to working as a team. And I want to thank Patricia for taking the lead in City Forward Collective and making sure that some of our needs have been met. I'm very grateful for all of the foundations who have been very flexible with grants and allowing us to make those decisions on how to use them to serve our families, but just that teamwork effort of we have to come together to find solutions. As Rob stated, everybody's going through this, and I think learning from what we know that happened in March and how do we slowly try to reopen schools, but also to provide that student and parent voice, because ultimately that's who we're accountable to is our parents, to ensure that their children are receiving that education. So they're all tough decisions. I think every single one of us is trying to figure out how do we do what's best in balancing the needs of our community and our families and students to give them that fighting chance of receiving that equitable education. But I think the silver lining is just the way we've all come together to learn from one another and really just try to be on the same page as much as possible as leaders in Milwaukee.
Anthony?
Yeah, for me, I think that not only with COVID-19, but also the social unrest that we've seen sweeping through our country, it's really continued to shine the light on the disparities that we have. But for us, the educational disparities is something that I think the philanthropic and the business community has really paid close attention to through this. And I'm hopeful that they will continue to not only support organizations like City Forward Collective and obviously our schools independently, but also continue to help to work to create one uniform movement to improve the education of kids here in Milwaukee, and not pit MPS versus other schools, but that let's all just collectively work together to make sure that all of our kids are sitting in schools that are providing a quality education. And I'm hopeful that we're one step closer to that, but many more steps to go.
Patricia?
Well, I'm just, I'm hopeful that we have leaders like you've heard from today, like these 3 school leaders and all the other ones that are working so hard. But even though it's really hard to appreciate now that this kind of disruptive change, what it does to you, but it also is, my optimism is that it's going to breed innovation. And I think we're going to see new ways of educating children that we weren't ready or prepared to think about before, that are going to be permanent long-term solutions for addressing some of the inequities that we've raised today.
Great. And Dr. Raymond, best piece of good news you can leave us with.
Well, everybody said some great things. Since I'm on Anthony's board, I just want to highlight what he said. I think this is shining a light on inequities in the education system and the availability of education. And for the good of our country and for our region, we really do need to address the issue of equity. And I think as we come out on the other side of it, the innovation that Patricia talked about is going to help us get there.
Great. So Rob, thank you very much for your leadership and your time. Patricia, really appreciate City Forward Collective, what it's doing. Laura, thank you so much for UCC and its impact on our community. And Anthony, thank you so very much again for your leadership. And Dr. Raymond, if you all want your Dr. Raymond fix, join us at 4:20 on 6:20 a.m. this afternoon. And you can get that fix and get an update on where we are going forward. So again, I wish you all the best with the school year, virtually or in person, and please let us know how we can all help you serve what is our future, our kids. So thank you so much.
Thanks, Tim.
Thank you.